Hi, my name's Robin Chester and 10 years ago I was diagnosed with prostate cancer. While such news is never pleasant to hear, I was by no means on my own in receiving this diagnosis. Prostate cancer is the most common form of cancer in men in the UK, and 1 in 8 will be diagnosed with the disease at some point in their lifetime. In the UK, more than 52,000 men are diagnosed every year. While such news is never pleasant to hear, I was by no means on my own in receiving this diagnosis. Prostate cancer is the most common form of cancer in men in the UK, and 1 in 8 men will be diagnosed with the disease at some point in their lifetime. In the UK, more than 52,000 men are diagnosed every year. That's 144 men every day. Sadly, every 45 minutes, one man dies from the disease, adding up to more than 12,000 deaths each year. Worldwide, there's estimated to be nearly 1.5 million new cases every year. Whilst it is possible to be diagnosed under the age of 50, it is very rare. Only 1 in 456 men will get prostate cancer under this age. However, once this milestone is passed, the odds shift dramatically. The statistics are as follows. Between 50 and 59, 1 in 54 men will be diagnosed. Between 60 and 69, 1 in 19, and over 70, it's 1 in 11 men. Like all cancers, early diagnosis plays a critical part in surviving the disease. When I look back on my experience, I now realise that my failure to act on my fears almost cost me my life. I know I'm incredibly lucky to still be here to tell the tale, and it's for this reason that I'm here today and attempt to prevent you making the same potentially fatal mistakes that I did. First of all, what is the prostate and what is its function? The prostate is part of the male reproductive system. It's a small walnut-shaped gland that sits just in front of the rectum, and its function is to produce seminal fluid which helps carry sperm to the egg. The urethra that runs from the bladder to the penis passes through the centre of the prostate. Now that we know what it is, what are the signs to be aware of? There are a number of symptoms that you may experience that could be an indication that something is amiss. For instance, difficulty starting urination, weak or interrupted flow of urine, urinating more often, especially at night, trouble emptying the bladder completely, pain or burning during urination, blood in your urine or semen. It's important to realise at this point that even if you have 1 or more of these symptoms, it does not automatically mean that you have prostate cancer. In most cases, this will not be the case, and your problem will likely be much more benign. However, this does not mean that you should not get checked out. When caught in time, prostate cancer is eminently treatable, as the following statistics will show. More than 95% will survive their cancer for more than 1 year, more than 85% for 5 years or more, and almost 80% will survive their cancer for 10 years or more, and almost 80% will survive their cancer for 10 years or more. So, if you act quickly, the odds are firmly on your side. When you go to see your GP, they'll most likely inquire as to your symptoms, your background, for instance, is there prostate cancer in the family? Have you had any weight loss? And ask you about your general health. You may also have to give a water sample in order to test for blood or nitrates, which would indicate that you have an infection. If there's any possibility that the problem is prostate related, then you will undoubtedly be given a prostate examination. For a lot of men, it is this initial examination that seems to summon up a completely unwarranted dread. A recent survey showed that concern over pain and discomfort deter over 40% of men from having this examination. All I can say is that having numerous such examinations, there is nothing to be worried about. It's not painful, perhaps a little uncomfortable at times, but it's over within seconds. So, if you are worried and thinking of delaying, then don't. It's important to know that at the very early stages of prostate cancer, you invariably have no symptoms. So by the time that they do present themselves, you are already likely to have had the disease for some time, and therefore it's vital you don't prolong your diagnosis unnecessarily. I should also point out at this stage that ethnicity also plays a part, with black men twice as likely to develop the disease as white men. That means that 1 in 4 from an Afro-Caribbean background will be diagnosed with prostate cancer. If there is a concern over the health of your prostate, you will be sent for a PSA blood test. PSA stands for prostate-specific antigen, which is a protein that is secreted by the prostate and which should be found in the blood in tiny quantities. If your PSA is elevated to a score of over 3 nanograms per milliliter, then this may be an indication of cancer, and it is at this point that you may be advised to have a biopsy. A biopsy is the most accurate method of detecting prostate cancer and correctly diagnoses disease over 90% of the time. This procedure, which is performed under a local anaesthetic, involves taking either 10 or 12 samples of tissue from the prostate, which will then be examined under a microscope. If you are diagnosed with prostate cancer, then what are the most common treatments? First of all, there's surgery, which is known as a radical prostatectomy, involving the complete removal of the prostate gland. This is a major surgical procedure and will require an extended stay in hospital. Hormone therapy. This is used to control or manage your cancer. It will not cure it. It works by stopping your body from producing testosterone, which prostate cancer cells need to thrive. Radiotherapy. This is done via a machine that aims high energy rays at the cancer from outside the body. The treatment consists of short, daily treatment and is mostly commonly done over a period of either 4 or 7 weeks. Brachytherapy. This is another form of radiotherapy, but instead of attacking the cancer from outside the body, radioactive seeds are implanted directly into the prostate. There are 2 different types of brachytherapy. A low dosage treatment where seeds are implanted permanently into the prostate and which release their radiation over a long period of time, and there's also a high dosage treatment where the seeds are removed after 30 to 40 minutes. Both procedures are done under a general anaesthetic. Lastly, there's chemotherapy. As you'll probably know, this is a drug treatment administered via a cannula that uses powerful chemicals to kill fast-growing cells in your body, and is generally only used on men with advanced prostate cancer. The type of treatment you receive will be dependent on such things as the stage and grade of your cancer, your age, general health, and your PSA level. The most common system for ascertaining the grade of cancer is by what is known as a Gleason score. This is determined by the size and abnormality of the cancer cells which were taken during the course of your biopsy. Basically, the higher the Gleason score, the more aggressive the cancer. Also, it may well be that, like myself, you could receive a combination of these treatments. Regardless of what treatment is undertaken, because of the position of the prostate, its proximity to the bladder, bowel, erectile nerves, delicate blood vessels, and the invasiveness of the treatment, there will undoubtedly be side effects. These can include diarrhea, pains in your bowels and bladder, stomach cramps, skin soreness, as well as weakness and fatigue. However, the most common and possibly long-lasting side effects are twofold, and these are urinary dysfunction and erectile dysfunction. Both severity and longevity of these 2 side effects are difficult to quantify, as they will be dependent on a number of factors. Your general health and well-being, both physical and sexual, prior to surgery, your age, the position and severity of the cancer, whether either of your erectile nerves were spared during surgery, and the type of treatment you received. Urinary dysfunction tends to be less of a long-term problem, and whilst the overwhelming majority of men will have problems initially, 90% will have gained full control of their bladder within 1 year. Erectile dysfunction, however, can be a much more of a long-term issue. Even in an ideal scenario where you have a radical prostatectomy and both your erectile nerves are spared, there will still be only 50% of men who will recover pre-surgery sexual function after 1 year. Obviously, whilst it is advisable to go in with your eyes open and be aware of these side effects, you must not let them cloud your judgment when it comes to deciding whether or not to have the treatment. Whatever the possible repercussions may be, they are certainly preferable to the alternative. Besides which, there are medications, exercises and treatment which can help you enormously if you were to suffer from these problems. In summary, if you are male, it is highly likely that you will have some type of prostate-related problem at some point in your life. To reiterate, 1 in 8 men in the UK will get prostate cancer, 1 in 4 if you are from an Afro-Caribbean background. 50% of men over 60 will suffer from an enlarged prostate, and approximately 8% will suffer from prostatitis, which is a severe inflammation of the prostate. Let's be clear, cancer does not only happen to other people. In February 2013, I was personally able to vouch for this fact. Avoidance, procrastination and denial are not options when it comes to defeating cancer. From personal experience, I know how easy it is to brush your fears aside. I'm not going to the doctors, it's not worth it. I'm just getting older. It's nothing, I'll be fine. And for a while, the head in the sand technique does work for you. You will be fine, until the day arrives when you are not. By the time I was diagnosed, my PSA was 78, which is basically off the scale. I had a high Gleason score and I had stage 3 cancer. I'm so fortunate to have survived. Only a week before my procedure, the surgeons were still debating whether it would be futile operating. If they had decided not to go ahead, I would not be stood here talking to you today. However, if I had taken swifter action and more decisive action and got myself checked out 2 years earlier, then I'm certain that my prognosis would not have been anywhere near as dire. Don't forget, 1 in 54 men over the age of 50 will get prostate cancer. But if you have a history of prostate cancer in the family, or you're from an Afro-Caribbean background, then the odds are significantly worse. Please, if you have any concerns at all, even if the symptoms are not that severe, do not hesitate to see your GP. You will not be wasting anyone's time, there's no need to be embarrassed, and no, your initial examination will not be painful. When you do get checked out, the likelihood is that you'll be fine and that your problems, if any, will be far more benign than cancer. But if it is, then getting diagnosed early, instead of at some other point down the line, could be the difference between having to say goodbye to loved ones far too early or having the joy of spending all that additional time with family and friends. So, if what I have said has struck a nerve, then act now. If it is cancer, then your journey to getting cured will have already begun. And if it's not, then all that worry will magically disappear. Thank you for listening and stay healthy.